Today, we're going to tackle one of the most testable topics in nursing school, and one of the easiest to get mixed up if you don't have a solid system, your normal electrolyte values. Now, I'm not here to throw a boring chart at you. I'm going to give you my favorite memory hooks so you can recall these numbers and symptoms without staring at flashcards for hours. By the time we're done, you'll hear a number and instantly know which electrolyte it belongs to, what happens when it's too low, and what happens when it's too high. Let's get started. Sodium. Normal range is 135 to 145 milliequivalents per liter. This is the biggest one you just have to memorize, 135 to 145. Here's a mental picture. Imagine you're going on a beach vacation and the perfect temperature is 135 to 145 degrees, if you're measuring in Phoenix heat index humor. When sodium is low, I want you to think brain first. The brain is the drama queen here. Confusion, headache, seizures, even coma. When sodium is high, think dry and swollen. Patients are thirsty, agitated, restless, and yes, they can seize from this too. Potassium. Normal range is 3.5 to 5.0 milliequivalents per liter. This one's easy. Bananas come in bunches of 3 to 5. When potassium is low, everything is weak. Weak muscles, irregular heartbeat, leg cramps, constipation. When potassium is high, everything gets tight and twitchy. Dangerous arrhythmias, muscle spasms, and in the worst case, cardiac arrest. Calcium. Normal range is 8.5 to 10.5 milligrams per deciliter. Think about a gallon of milk. It weighs somewhere between 8 and 10 pounds. When calcium is low, the nerves and muscles get jumpy, tingling, muscle spasms, and those famous positive Schwostek's and Trousseau's signs. When calcium is high, the opposite happens. Everything slows down. You'll see weakness, constipation, and confusion. Magnesium. Normal range is 1.8 to 2.6 milligrams per deciliter. A magnifying glass makes things about 2 times bigger, so think 2 as your anchor. When magnesium is low, your patient is jumpy and irritable. Tremors, muscle cramps, seizures. When magnesium is high, remember slow and low. Weak muscles, low blood pressure, and decreased reflexes. Phosphate. Normal range is 2.5 to 4.5 milligrams per deciliter. Here's your hook. Phos for us. 2 of us, 4 phosphates. Reverse it and you've got 2.5 to 4.5. When phosphate is low, think weak, muscle weakness, bone pain, even respiratory failure. When phosphate is high, think tight, cramps, tingling, and the same signs you see in low calcium, because phosphate and calcium move in opposite directions. Chloride. Normal range is 98 to 106 milliequivalents per liter. Think of a hot tub. The water is perfect at about 100 degrees. When chloride is low, the body is hyperactive, twitching, tetany, shallow breathing, and it often comes along with low sodium or potassium. When chloride is high, the body slows down, lethargy, deep, rapid breathing, and in severe cases, arrhythmias or coma. So there you have it. Electrolytes made simple, with numbers that stick and symptoms that make sense. Save this video for your next exam review, because the more you hear these hooks, the faster they'll pop into your head during a test.